Dr. Amy Edwards is an infectious disease specialist at UH Case Medical Center in Cleveland. Thank you so much, Doctor, for being with us this morning. And the first question is, in Liberia, one of the countries hardest hit by the outbreak, they've cut off large parts of the country. But can countries like Liberia contain the virus there?
Well, I mean, it's hard to say. The capacity for containing an outbreak like this is going to vary from country to country. Certainly, it requires a lot of equipment and a lot of people, which is why the World Health Organization has made this declaration. I think that Liberia and the other countries will likely need our help.
You know, and you're talking about material that's so important. NBC's Kate Snow reports that some aid workers in West Africa are running out of containment supplies. What will that mean for the fight against this virus?
Well, it makes it exceedingly dangerous to be a caregiver for an Ebola patient if you don't have the proper personal protective equipment. And one could imagine that it could cause some health workers to refuse to report to work if they're not going to be properly protected from the patients.
Here in the U.S., the CDC elevated their Ebola response to the highest level. What does that mean for the fight against the disease here, which we know is not spreading?
Well, the CDC is going to be an important center for testing samples, for instance. So this increase in response will hopefully mean a faster turnaround time for some of the samples that will be processed from Africa. It'll also mean likely more epidemiologists and people to help with coordination, which should hopefully allow us to have a more accurate idea of exactly what's going on and where it's happening.
Doctor, here's a question I've had for a while now. You know, they brought out a priest, a Spanish priest from West Africa, took him to Spain. He's still very critical, but he seems to be getting better, and these two Americans seem to be getting better. Why are some people surviving this and 70, 80% not?
Well, that's a great question, and if we could answer that question, we would have a lot more information than we currently do. With all of the hemorrhagic viruses, we know that the individual immune response is very, very important. As you know, there's no therapy for this, and so it's up to the individual person's immune system. And we do know in this hemorrhagic virus and in other hemorrhagic viruses, through research that's been done, that some people have a stronger immune response, and some people seem to lack that immune response or even have a maladaptive immune response where their immune system actually makes things worse for them. And so presumably that's one of the major factors in whether somebody survives or is unable to survive.
Dr. Amy Edwards from UH Case Medical Center, thank you so much for being with us this morning.
Anytime.
And that